everybody. It's Stephanie Morimoto, owner and CEO of Asutra. I am so excited to be talking today to one of our advisory board members, Dr. Soyona, who is an expert in all things women's health. Dr. Soyona, it's so great to have you here today. Can you share your name and your background?
Yes, thanks for having me. I'm Dr. Soyona Rafatjah, and I practice family medicine, but most notably functional medicine and integrative medicine. That's where we try to look for the root cause of illness as opposed to using just medications to cover up symptoms. We try to get down to the root cause and address them as naturally as possible.
I love that that's such a core part of your practice. It's so much in line with what we believe at Asutra, that taking care of yourself on purpose helps you be your best in life. And it's all about being holistic, right? Mind, body, and soul. And our products are also about creating natural formulations and rituals that can help you with things like better sleep, relieving your pain, and reducing stress without having to take as many pills or prescription medications. So Dr. Soyona, as you know, we love magnesium, and in particular topical magnesium at Asutra. Can you tell us, how does magnesium help with women's health overall?
Magnesium's amazing. In my practice at PrimeHealth in Denver, we see a lot of women. We actually run a women's health group to make functional medicine more affordable for women who can't necessarily afford the one-on-one care. And magnesium is actually a part of our supplement protocol that we do for our women in the women's health group. And almost every person that comes into our clinic honestly leaves with a recommendation to use magnesium in some form or another. And that's because the majority of us, like 65+% of US Americans, have been found to be deficient in this powerful mineral, magnesium. And it's important for several hundred reactions in our body involving the ability to lower our blood pressure even and prevent heart disease. So it's really, really powerful, being that the number one killer of men and women in our country is heart disease. If you can relax your blood vessels to an extent and lower your blood pressure and actually prevent further, onset of cardiovascular disease, it's incredibly powerful. And for women specifically, it's amazing because it can even help with relaxation of the uterus, and that can have amazing effects for women who have menstrual cramps. And whether they be, pretty mild or on the severe side of things, I've seen women improve immensely by using magnesium in various forms and come off of pharmaceutical medications or the need for over-the-counter pain medicine because of using magnesium.
Wow, that's incredible. I have to say, I use our magnesium oil spray topically when I have menstrual cramps. I'll literally spray some in my hands, massage it into my tummy, and I do feel an improvement. It just really helps me feel more relaxed and eases some of those cramps and symptoms of PMS.
Oh yeah, absolutely. I've had the same experience, using the Sutra cream or taking a bath in the magnesium flakes. I mean, it's incredibly powerful.
I know you love the Asutra magnesium bath flakes. You talked about actually using them while you were pregnant. Can you share more about how a magnesium bath is helpful if you're pregnant or postpartum or even just for other issues?
Yes, absolutely. I mean, it's great in every stage, but specifically when I was pregnant, you start to gain a lot of weight and your body is shifting a ton and ligaments are relaxed and starting to get sore and everything's starting to change, especially in the third trimester. So, you're not supposed to really take a hot bath because you don't want to submerge, the baby in a really hot environment. But, you can take like a warm bath for sure and soak in the magnesium flakes, and it's just incredibly relaxing. So like how I was saying, that it can relax your blood vessels, relax your uterine muscle, it can relax any muscle in your body. So when you're sitting in the bath for like 15 to 20 minutes, it's incredibly relaxing. Even mentally, your brain gets a little relaxed, and it is a pain reliever as well. So it's just all around an amazing thing to use for aches and pains, and especially, in pregnancy when you really don't want to be taking pharmaceutical medications at all, even topically. You don't want to use like topical steroids, topical, NSAIDs. I mean, you just want to avoid medicine at all, like if you can, when you're pregnant. So using something like magnesium in the form of the bath, and I also especially really loved the nighttime cream lotion that had the melatonin in it. I thought that was amazing when I was pregnant, and then also postpartum for sure as well. Of course, there's a certain period of time that you're not supposed to submerge, in a bath, but after that, a couple of weeks, once you're cleared from your OB-GYN, you can certainly indulge in a nice bath.
We've talked about magnesium for women in menopause as well, right? We've talked about how magnesium can help with estrogen and other hormones. Can you share more about what happens with our hormones when we have menopause, and how does magnesium help with those hormones?
Yeah, there's some really fascinating things that happen with magnesium and the way that it balances your hormones. And so actually, I mean, this really does apply to people who are perimenopausal, meaning about 5 to 10 years before you actually hit menopause, the cessation of your periods. You can have symptoms of menopause for up to that long, really. Unfortunately, some women have that. And a big hallmark of perimenopausal symptoms, and even PMS as well, is something called estrogen dominance. And that's how it basically describes how progesterone will start to fall before your estrogen levels do. So in women, our ovaries produce estrogen and progesterone in large quantities throughout our menstrual cycle in varying amounts. But as we get closer to menopause, those amounts will start to drop. And initially, it's the progesterone that stops forming as much. And progesterone is really like the pregnancy hormone. It's very calming. It's very relaxing. It's relaxing even for your mind. It's relaxing, and it's relaxing for your ligaments, similar to kind of like how magnesium works in that way. Because when you're pregnant, everything has to stretch. So progesterone is helping you do that. So when we're losing our progesterone, but keeping our estrogen levels, we're entering a state of what's called estrogen dominance. And that mismatch of how much progesterone we have versus estrogen can cause a host of symptoms. And those symptoms will be things that you think of when you experience things like PMS or perimenopause. In perimenopause, it can lead to mood swings, hot flashes, inability to sleep, and insomnia, agitation. And so it's interesting when you compare progesterone and magnesium, because they really both do have this relaxing effect. So if you're lacking the progesterone, giving yourself the magnesium kind of like helps with those symptoms. And in addition to that, it can help you eliminate estrogen more properly.
How does magnesium help you eliminate estrogen properly?
Yeah, good question. So estrogen's eliminated in a number of ways, in our body. We make a certain amount every day, and so we need to also get rid of it. Otherwise, you're just going to keep building up estrogen in your body. So the way we get rid of it is actually through urine excretion and bowel movements in our stool. So the way that we can kind of transform estrogen into an excretable form is through our liver. So our liver has enzymes that actually metabolize estrogen into an excretable form, and then it comes out through the urine or the stool. And of course, you have to be regularly urinating, drinking plenty of water, and having bowel movements every day. So magnesium regulates the amount of estrogen that's being excreted by augmenting the liver enzyme function. And it also helps because when you absorb magnesium, it actually helps relax your bowels and helps you have more regular bowel movements.
It's so interesting that you just mentioned the connection between the right levels of magnesium and having regular bowel movements, because when I talk to people about magnesium and they don't know a lot about it, I say, well, yeah, it can help. Magnesium can help relieve your muscles. It can help relieve muscle cramps. It helps you feel calmer. And when they ask, how does it help you? What do you mean relieve muscle cramps? And I said, well, remember back in the day, milk of magnesia,
Mhm.
which was used, right, to help you have regular bowel movements. And they're like, okay, I now remember that. And it kind of clicks in their mind
Mhm.
when they do
Yeah.
recall that. Let's talk about topical magnesium versus oral magnesium. I know you and I have talked about when you might use topical magnesium versus oral magnesium. When would you recommend one over the other?
Yeah, that's a great question. So I think topical is fantastic for a number of reasons. One would be if you have bowel sensitivity to magnesium that's oral. So it will increase your bowel movement. Some people, I have patients that they can't even tolerate like one pill of magnesium because it will make them have diarrhea. So that's a classical example of I want this person to absorb magnesium systemically for some reason, whether it's relaxation, sleep, menstrual cramps, blood pressure, whatever reason, I will have them do it in a topical form. And, in that situation, I'll have them put it directly on any location that might need extra relaxation. A great place to put topical creams that you want to absorb well is around places where you can see your blood vessels. So that would be like in the inner elbow, inner knee, like the bending side, the inner fold. Those are great places to put anything topical if you don't have like another spot that's necessarily aching. And so, yeah, if you want to avoid basically the bowels effect. And then another reason would be if you have a local place that we are trying to target. So let's say someone has like nightly leg cramps. That's definitely something I experienced when I was pregnant, was getting kind of like these like crampy, like almost like restless leg. It's like such an uncomfortable feeling. So I would lather on the magnesium at night, and it was so helpful, so helpful. So something like that, like whether it be like a muscle spasm, sore muscles, joint pain, anything like that, or even tension headaches, you can put it around like your occiput, like back of your neck, kind of neck muscles, even like around your forehead, that would be great for headaches too. Magnesium's amazing for that.
I love to give myself a little neck massage before bed. I'll either use the magnesium oil spray, so I'll just spray it 5 times in my hands, rub it, and then massage it into my neck. It feels so relaxing. Or if I really need some magnesium and some moisturization, I'll use one of our Asutra magnesium lotions and do that same neck massage. And it really does help me relax and sleep well.
Mm-hmm.
So I'm so curious, why would you put topical magnesium, a spray or a lotion, where you can see a blood vessel? So in the inside of your elbow or the inside of your knee, what's the connection there?
Basically, if you can see your blood vessel, that means it's close to the surface. So it's going to get absorbed more readily into your bloodstream.
That's so cool. I learned something new. I love that. I love what you were also saying about the power of topicals to go right to the source of the pain or the cramp that you're feeling. Let's talk a little bit more about that. I know you really focus on more natural and holistic methods for helping people either address health issues or take care of their health overall and maintain or improve their health. Tell us about your thoughts on why topical pain relievers might be a good or safe option for people versus pills.
Yeah, a lot of reasons for that. I mean, of course, first of all, imagine someone is already magnesium deficient and they're in pain. A big part of why they might be in pain is because of the magnesium deficiency. So that alone, just making them less deficient in magnesium will relax their connective tissue and their muscles and allow them to be at like a normal baseline. So it's like, getting to the root cause of the issue, instead of trying to like symptom management, use a pain medicine that's then going to cause potentially a kidney issue or a liver issue or something like that. It's like, let's just take care of the root. So like replacing minerals is super important. So that's one. The other thing is, medication interactions. So if you're especially taking other medicines, like let's say a blood pressure medicine that already might be affecting, your kidneys, or, another medicine that might be affecting your liver. I mean, if you add another medicine that could be like a pain specific medication, it could be a medication reaction, or it could, in terms of like making the other medication too concentrated or not concentrated enough in your bloodstream, or it could even be harmful to your organ systems, like your liver or your kidney, that normally are the ones responsible for getting rid of the medication. So I find it really helpful to use a topical medication in those situations so that we can avoid any kind of interaction or organ compromise.
Are there any risks to having too much magnesium in your system?
It's a great question. Yes, absolutely. And you would really normally see those types of situations with IV magnesium because you're putting it directly into your vein and it's going unchecked. But if you're using, let's say, a topical magnesium, I mean, I don't think that your body can absorb magnesium fast enough to take you to a point where you would be toxic at toxic levels of magnesium, because magnesium is involved, like I mentioned, in heart health and actually, relaxing the blood vessels, calming the muscles of your heart and relaxing them. So yes, you can go to a point where if you have huge, massive amounts of IV magnesium, you can actually get into a arrhythmia where your heart actually has irregular heartbeats. But through, topical, I really don't see that happening. And also, even in oral, like you would actually give yourself diarrhea before you absorbed so much magnesium to the point of causing a actual problem.
Your body would get rid of it before it became toxic if you were taking it orally or topically.
Yes.
For oral magnesium, is there a particular type of magnesium you like to recommend?
Yeah, it kind of depends, because if I'm going for a more systemic effect, like let's say someone does really need help with their sleep and they need to be absorbing a large amount of it in order to really calm their nervous system or calm their muscles, or maybe like dealing with really severe menstrual cramps, something like that, then I might use something that's really well absorbed, like a magnesium chelate blend or magnesium glycinate blend. Um, Also, one that is known to cross the blood-brain barrier is magnesium threonate, like a neuromag complex. Whereas if I want someone to really help clear out their bowels, like let's say they have really severe constipation and we really need them to be detoxing, and of course we're going to try to fix the root cause of what that might be, like dysbiosis, bacterial problems, yeast, whatever it might be. In the meantime, we still want them to be having regular bowel movements. And so I'll give them a form of magnesium that's less absorbable and more likely to come out through the bowels and cause that kind of osmotic diarrhea almost. And that's magnesium citrate is a nice gentle one. Or if we need to go more powerful, we'll go magnesium oxide.
Oh, interesting. I didn't know about the fact that actually less absorbable magnesium helps you clean out your system, but that makes a lot of sense. That's really
Yes.
interesting. I feel like I've seen a lot of people talk about magnesium crossing the blood brain barrier. Can you explain what that means? What does crossing the blood brain barrier mean?
Yeah, I mean, so we have certain areas of our body that have what's called like tight junctions. So we have like cells that are lined up really tight next to one another and really should not be permeable for various reasons. Like, for instance, in our blood vessels, we have that. We don't want our blood vessels leaking out. And we have that in our gut. We don't want things leaking out of our gut. And that can happen where, you call it intestinal permeability or leaky gut, and that can be really inflammatory. And then we have another area at the blood-brain barrier where we don't really want things crossing between where the brain is and the rest of our body for various reasons. Like the brain is such a protected space that, like, let's say we do have a systemic infection in our body, like there's that safeguarding where it's not going to necessarily go to our brain, an area that is like basically running the mothership, and things won't necessarily shut down that way. So it is harder to cross those tight junctions. And so there are certain forms of magnesium that are better than others at that.
Hmm, interesting. Cool. Um, Earlier, you talked about using Asutra's Dream the Night Away lotion. That's the one that has melatonin and magnesium when you were pregnant to help with sleep at night. Tell us more about that experience. And also, what do you think about using melatonin to support good sleep?
Oh, I think it's fantastic. Of course, when you're pregnant, there isn't like amazing safety data on melatonin. So I did switch to the regular magnesium one eventually when I was pregnant. But before getting pregnant, actually, when you're trying to conceive, melatonin is amazing. There's actually been studies where they've shown that 3 milligrams of oral melatonin was shown to improve egg quality and increase chances of conception in some studies. So that's actually a part of the protocol for a lot of reproductive endocrinology clinics that are working on people trying to get pregnant through various modalities like IVF or what have you. They'll add oral melatonin into the mix, and it's fantastic. I mean, it is a hormone that's made by your pineal gland in your brain, and it increases in concentration basically as the lights come down and the sun goes down. That's why artificial light can be so harmful for us. But when it's dark and when it's nighttime, our body's circadian rhythm naturally has you create melatonin and secrete that into your bloodstream, and that's how you get sleepy. But some people, might need some help with production, or let's say you just have trouble sleeping. Increasing your concentration of serum melatonin can be extremely helpful in creating that sleepiness and getting you to go to sleep. So yeah, and topically, it's a great way to administer it.
That's great. Why did you use magnesium lotions at bedtime? How did that help you?
Oh, in general or when pregnant?
In general.
In general, yeah. I mean, magnesium, like I mentioned, it's a relaxant. It's incredible for calming the nervous system and getting you ready to fall asleep. I mean, this is another one of those kinds of like magic situations where sometimes we'll have people just take magnesium and use magnesium and they don't need to use other things anymore. Like it's one of those amazing situations where whether it be anxiety or insomnia, just having someone use the magnesium, having that ritual as well, like you mentioned, like that nighttime ritual, kind of like a little self massage for a few minutes, and then relaxing into sleep. Because sometimes people also have pain that keeps them up as well, so it's like a double whammy because it's helping with the pain and then it's also getting absorbed and helping you relax into sleep as well.
We hear that a lot with our Asutra users who use our topical magnesium, that they have aches or pains. Maybe it's chronic pain issues or they're recovering from an accident or an injury. And it's the pain that actually wakes them up in the middle of the night. So if they use a magnesium oil or a magnesium lotion or take a magnesium bath, just helps alleviate those aches and pains so they're not getting woken up by that in the middle of the night.
Yes, definitely. Mm-hmm.
So switching gears a little bit, I think another reason you and I originally connected so well is we're both women of color. We both have Asian American backgrounds. How do you think about or connect your Asian American heritage to how you administer healthcare and support women's wellness?
Yeah, it's really fun for me. I really, I'm proud of my heritage for sure. Half Korean and half Persian. And unfortunately, I don't have that many Asian parent patients because I live in Denver, Colorado, and um, it's just not that Asian diverse. But once in a while, I'll have an Asian patient. It'll be exciting. But I used to live in New York City. I had a lot more. But there is definitely differences in our health and the way that we operate, especially from checking my blood work, checking other Asian people's blood work over my career. And one of the things that we really need to pay attention to as Asians is blood sugar. This is a major problem for a lot of people, is managing your glycemic control. And it's a number of things. I think our genetics, put us at risk for whatever reason, Latin Americans as well, and African Americans, like we all kind of have higher risk of developing things like prediabetes and diabetes than Caucasians. So making sure to track, have your doctor look at fasting glucose, fasting insulin. That's a really important one. And hemoglobin A1C. Those are the main three markers that we use to track glycemic control. And And a lot of times insulin level will get elevated before glucose even, like for fasting. And that's a sign of insulin resistance, meaning body's getting too many carbohydrates, too many sugars to be able to handle. And so insulin is just rising, rising, rising. And that insulin will cause all kinds of metabolic disturbances and weight gain, especially in the midsection. I mean, Asian people have a certain body type. They, are thin overall. They have thin limbs. They come off as being, oh, I can eat anything and I don't gain weight. But you got to look under the hood, because even though you are eating all that rice and all those noodles, your glycemic control, that glycemic control is not good. And we will gain weight in our midsection. And unfortunately, that ends up being really inflammatory. That is called visceral fat. It's the fat that surrounds our organs. It's not necessarily like in the abdomen, like on top of your abs. It's like in your organs. It's like surrounding your organs in your abdomen. And that's incredibly inflammatory fat. And that messes with your glycemic control. So it's just important, for Asians to be aware of this, because it's not going to be the case in Caucasian. So if you're going to a Caucasian doctor and they don't really understand this, you're going to have a normal BMI because you are a thin person overall. But, what's your body composition? That is incredibly important to keep in mind as Asians. And then bringing it back to magnesium, another one of the functions of magnesium is actually glycemic control. So if you are deficient in magnesium, your glycemic control is going to be even harder. So that's really, really important.
Oh, I also learned something new there. That's really interesting. I mean, it's a good thing that you point out that Asians have that higher risk, perhaps, of diabetes or glycemic control. My grandfather was diabetic. He developed diabetes.
Mine too.
And he was so disciplined that he somehow managed to essentially manage his insulin levels and his glycemic index through diet and exercise. But it's definitely something to watch out for. So my family and I have definitely cut back on the rice and noodles for sure.
I know. I mean, it's like evolutionarily we ate those things, sure, but we were also like out farming and we weren't sitting at a desk all day. It's just, we have to realize that we're not living the lives of our ancestors. And so we have to try to, tone back on certain carbohydrates that we're so used to eating.
Is there any research you've seen that shows why people of Asian descent have that higher risk of?
I've looked into it a lot because it is really notable that, specifically myself, I've noticed myself like so incredibly sensitive to glucose, and my hemoglobin A1C, like I put myself into the pre-diabetic range when I went to Italy for a week and just gorged on bread and pasta, and it was amazing. But like that wouldn't happen to, I don't think, an Italian person, So I don't know. I've tried to do research on that. I just don't think it's really been studied.
Yeah. Me too. I'm also very sensitive to simple carbs. So whether it's breads or pastas or rices, I really have to pay attention to that. And one doctor I saw recommended, limit the amount of carbs that you eat from things like rice, bread, pasta. If you eat carbs, focus on complex carbs, right? And then the other thing he recommended, which I thought was really interesting, was eat protein first. So if you're going to have a meal with carbohydrates, eat the protein first and then the carbs. And that order of eating protein first and then carbs second helps your body, I guess, control your glycemic index more. And we did monitoring, and it totally bore out in the data.
It really does work. I think there's a book called Glucose Revolution where she talks all about that too. And it basically slows the release of the carbohydrates into your bloodstream. If you have protein and or fat in your system as you're taking in those carbs, so it's not going to spike your glucose the way that it would if you didn't have that.
Yeah. I also love learning that having the right amount of magnesium in your body helps with maintaining the right glucose levels.
Yes.
And inflammation in your body, which, as we know, is good for you in general.
Mm-hmm.
I want to go back to one thing about magnesium and women's health in particular. We talked about this before too. So we also have talked about how magnesium helps with calcium in your body. And obviously calcium is so important for us as women, particularly as we age. Can you talk more about how magnesium and calcium interact?
Yeah, they have a really interesting relationship. They kind of are, counterparts, and they're necessary for one another to operate properly. So basically, as I mentioned, magnesium is like a relaxant, and calcium is more like an excitatory mineral. So calcium in our system is going to activate. Like it's kind of like an activator for muscles and different things like that. So people who have excessive amounts of calcium in their system, they might have constriction of their blood vessels, cramping of their muscles. Like if you take an excessive amount of calcium pills and you're not taking magnesium with it, you can actually create muscle cramping for yourself. So you need to be taking them together. That's why CalMag, you'll see that kind of on supplements sometimes. It's really important to take them together. And then in addition to that, magnesium also helps your absorption of calcium, and the way that you also your vitamin D operates. So these are all connected in calcium balance: vitamin D, magnesium, calcium, and then they all relate to your bone health. So magnesium deficiency is also involved in osteoporosis. It's associated with worse bone density. So it's incredible for that. I mean, what is it not involved in? It's it's literally involved in like everything. And so yeah, if I have a patient who has osteoporosis, then magnesium is absolutely going to be a part of their protocol.
Magnesium, it really is kind of magical. Over 300 healthy body processes, I think it's involved in, right? Brain, blood, heart, bones, organs, muscles. I mean, every part of your body, it's there.
Yeah.
If you liked this conversation about magnesium and want to hear more about magnesium, make sure that you like this video and subscribe to A Sutra.